And good evening, everyone, and welcome to tonight's webinar and the first part of our MSP2C Wellness webinar series. This is a three-part program brought to you by Can-Do Multiple Sclerosis and Sanofi Genzyme. My name is Brian Thompson, Senior Programs Manager for Can-Do MS. For those of you who are new to Can-Do MS, we deliver health and wellness education programs to help families with MS thrive. To learn more about our various programs and resources, please visit our website, which is cando-ms.org. We also encourage you to visit the MSP2C website. MSP2C provides resources to empower people affected by MS to be active partners in their healthcare and wellness experiences by focusing on shared decision-making. So visit msp2c.com to learn more about the various resources and programs that we're offering. And we're thrilled to be partnering with Sanofi Genzyme on MSP2C and this webinar series. So I'm going to introduce our two speakers that should be familiar faces to a lot of you that have been to Can-Do MS programs. We have Roz Kalb, who's a psychologist, and Mandy Roerig, who is a physical therapist, and they will be facilitating all three of our webinars during the series. So thank you, Mandy and Roz, for being here, and I'm going to turn things over first to Roz.
Hello, everyone. I'm excited to be here to talk about wellness with all of you and to work with my friend and colleague, Mandy. I'm looking forward to doing this series with her. As Brian mentioned, I am a clinical psychologist, and I've actually worked in MS for about 40 years now. And tonight I get to talk about some of my very favorite topics, which are the mood and cognitive issues that are so common in people affected by MS.
And thanks, Roz. I'm excited to work on this series with you as well. Welcome, everyone. My name's Mandy Roerig. I'm a physical therapist in an outpatient physical therapy setting in Nebraska. I'm also a senior programs consultant with Can-Do MS. I have been working with people who have MS for about 14 years now. So, and I always enjoy learning from Roz, and I enjoy learning from all of you. So we're glad that you have joined us this evening, and we look forward to you joining us for the rest of the series as well. So let's start out by looking at the big picture. So these are the 6 dimensions of wellness. So this entire MS Path to Care series will involve taking a deeper dive into each one of these dimensions of wellness. As Brian mentioned earlier, today we're just focusing on emotional well-being, spirituality, and cognitive well-being. So emotional well-being primarily involves attending to your mood, making sure that you are just keeping your emotional health well. Spirituality is kind of that exploration into how to maintain your sense of connectedness with the world, and we'll take a little bit examine that a little bit further at towards the end. And lastly, cognitive well-being, and that's just that attention to engaging activities that keep you intellectually interested in life. So who can help you with all of your symptoms of MS? And let's talk about this picture because there's a lot going on here. But what I want to point out first is the very center of it. And the very center of it is you and your support team or your family. You guys are at the very center of all of the decisions that are made by the remaining members of the healthcare team. All of the decisions that are made should be made in collaboration with you and your loved ones, and should be focused on the goals that you want to achieve. So the next circle is that blue circle. That's kind of your core healthcare team. These are the folks you might see every 3 to 6 months, maybe a year. These providers include your primary care physician, your neurologist, your nurse practitioner, physician assistant, and perhaps an MS nurse as well. But these are the folks that help you manage your MS and your overall health and wellness. They're also kind of the providers that give the referrals to that outer circle, that kind of greenish color of circle that you see. Those are kind of the other providers that you might use on an as-needed basis. So those providers are your medical assistants who take your blood pressure and your heart rate when you first come to an appointment, physical therapists, occupational therapists, nutritionists or dietitians, pain management specialists, speech language pathologists, urologists, and lastly, the mental health professionals, the psychiatrists and psychologists, as well as your pharmacists. Excuse me, I don't want to forget our pharmacists. So again, those are the folks that you will need, that you can use on an as-needed basis that can help you manage those symptoms. And again, this webinar is focused primarily on mood and cognition and spirituality. So of these folks who can help you with that, in addition to that blue inner circle, on the outer circle, your psychiatrist and your psychologist can help with your mood issues, and your speech language pathologist and your occupational therapist, in addition to your mental health professionals, can help with your cognitive issues. And when it comes to spirituality, you might have to look a little outside of the circle. We might have to look more towards your spiritual advisors, any religion that you might be affiliated with, other support groups, etc. Those might be where you find your spiritual guidance.
So thank you very much, Mandy, for laying out the groundwork so people get the big picture of all the wellness topics that we're going to talk about over the next 3 weeks. But for tonight, our goals for you is that all of you on the call, whether you are people living with MS or support partners, will be able to recognize common mood and cognitive changes that occur and have such an impact on everyday life. Be familiar with all those healthcare providers that Mandy was describing who can assist you as you look to enhance your wellness and manage symptoms that may be getting in your way. We want to make sure that you learn some approaches for addressing and recognizing the common mood and cognitive changes that occur. And as Mandy said, we're going to talk about different avenues that you might explore for enhancing your spiritual well-being. And of course, it's always important to be aware of potential barriers that you might encounter as you try to enhance your wellness in these areas. And what are some of the possible approaches you might try to overcoming those barriers? And so now I think Mandy is going to introduce us to our first scenario.
So we want you all to meet Pam and Sam. So for those of you who called in, this is a cartoon, and I'll show you guys, read this to our callers. I have a GPS device. It's a couple sitting with probably a mental health professional, and he's handing them a GPS device, and he says, I have a GPS device for each of you. The next time you drift apart, these will help you find your way back to each other. So sometimes you feel like you need that GPS when you're navigating the world of MS. So let's meet Pam and Sam. Pam's background: she's a 54-year-old accountant with active secondary progressive MS. She is married to Sam, and they've been married for 25 years and have 3 children. 1 still at home and 2 away at college. Daily activities that she is involved in is full-time work at an accounting firm. Her health insurance policy covers the entire family. That's a key issue. She likes to garden, travel, hike, and go to museums with Sam. But she has been having increased physical difficulties, specifically problems with weakness, balance, and falls. Shared activities with Sam are becoming increasingly challenging, and Pam is isolating herself while at the same time encouraging Sam to stay active himself. Getting to and from work has become increasingly difficult as well. So that's Pam. And Pam's mood changes that she's experiencing are pretty intense. She has periods of normal, healthy grieving, but then she feels now and then that the grief really never goes away. She's increasingly irritable and becoming more and more disengaged. Her cognitive challenges include increasing problems with attention, concentration, organization, short-term memory, planning, prioritizing, and information processing. Clearly, all of those will have an impact on daily life, including work and home activities. And spirituality. She's found some comfort in her religion in the past, but now she's just questioning her faith. I think she feels like her world's imploding a bit. She's lost cherished activities and is causing her to feel really disconnected from herself and the world around her. She's questioning herself. She's wondering, is this aging? Is it MS? Who am I? And how can I possibly reconnect? So, support partner challenges. So what are some of the challenges Sam is facing? Sam is sad. He's feeling very anxious about the future, understandably. He's missing the closeness that they used to have together. That's kind of drifted apart. At age 62, Sam has been considering retirement, but now he worries about their financial future. And from a physical standpoint, he's recently hurt his back while assisting Pam after a fall. And he too has some health issues of his own. He was recently diagnosed with type 2 diabetes. So wow, this couple has a lot going on. They have a lot going on. So it sounds like mood and cognitive issues are having a tremendous impact on this couple. Roz, tell us a little bit about how mood changes can impact people living with MS.
Thanks, Mandy. They do have a lot going on, and we wish that we could address all of their issues. But I think if we start with an understanding of Pam's mood and cognitive changes, that'll help us help them a little bit. So I want to start by talking about something that I almost always talk about when I'm dealing with mood, and that is normal, healthy grieving. When I first started talking about grieving in MS, people had trouble understanding why. They would say, well, nobody's died. What do you mean grieving? And I think it's important to understand that when an individual is handed a diagnosis of MS, it's really an intrusion, right? They've spent an entire lifetime building a picture of who they are, what kind of person they are, what makes them unique. It's a little picture puzzle of ourselves that we all develop over a lifetime. And suddenly the neurologist hands you an odd puzzle piece and says you have multiple sclerosis, and you have to figure out how that information about yourself is going to fit into the picture of who you are. And it takes time for most people to figure out where that information is going to fit. Some people don't believe it, they refuse, they think the doctor's wrong, they're going to prove that this is all a mistake. Some people literally kind of go to pieces for a while. It's very shocking, frightening information when you first hear it. That is a grieving process. However long it takes, people need to grieve over the change in their self-image, their change in this picture that they have of themselves before they can begin to take the steps that they're going to take to deal with their MS. And the thing that's so challenging in MS is that you don't just get to do this once, right? Because MS being what it is, it tends to take things away from you. Maybe it's a cherished activity that you used to love doing and now suddenly it's very difficult, or you can't do it anymore. Or you just have abilities that you used to count on, and now those abilities have been changed, or your cognition is different, or your body feels different. So like Pam, you may feel pretty disconnected from who you are. And that grieving process will recur every single time MS takes something away from you or changes the way you do things. And individuals and families share this grieving process. A support partner goes through a similar grieving process over the change in his or her life and in his or her expectations for the future. So what we have to be on the lookout for is when these normal, healthy feelings of grieving, which are going to occur every time there's a loss or a significant change, when, as in Pam's case, they start to just sort of blend into each other, into a consistent low mood where the person never really recovers from that feeling of grieving. They may become irritable, they feel disengaged and disconnected from themselves and from the world around them. And that's when we wonder and have to find out whether the person is experiencing a significant depression. So again, it can be hard to determine the difference. Here's grieving, that's a normal, healthy process that ebbs and flows. And then there's depression, which isn't normal or healthy and needs to be treated. So the trick is to realize that grief does ebb and flow, as any of us who have experienced a significant loss of a loved one. You have this peak, horrible feeling of sadness and loss that feels unbearable, but over time, nature provides. Nature helps us heal, and we gradually start to feel better. With grieving, that's the process. It ebbs and it flows. But with depression, it doesn't go away. It needs to be treated. Now, depression turns out to be one of the most common symptoms of MS. And I've said that very carefully, and I want you to make sure that you hear what I'm saying. This is not just a reaction to the challenges and losses that MS can cause. It is a symptom of MS that appears to be caused by changes in the brain and the immune system, as well as by those psychosocial challenges and losses that MS can cause. So it's kind of a triple whammy for people with MS, and that makes it a very, very common symptom. More than 50% of people living with MS are going to experience a major depression somewhere along the way. And I need to add that for different reasons, support partners of people with a chronic illness are also at much increased risk for depression. So how do we know what depression is? How do we diagnose it? What are some signals that we might look for? So these are the criteria that are used by mental health professionals to diagnose depression. It's a good idea to keep these in mind and to pay attention to yourself and to your mood. But what we look for is changes on this list that begin to occur most of the time for at least 2 weeks. They go on and on and on, and there's no real lifting of mood. The two most critical criteria are little interest or pleasure in doing things. So like Pam, people start to withdraw, to not care about things they used to enjoy, and they stop getting pleasure from hobbies, from sexual activity, from spending time with family and friends. And also feeling down, hopeless, depressed. So those two are sort of the cardinal symptoms, and we're always on the lookout for those. But also trouble falling or staying asleep, feeling tired, having very little energy, feeling just slowed, having major changes in appetite, poor appetite, or overeating, so that there's significant weight loss or weight gain, feeling bad about yourself, having difficulty concentrating. You just sort of move more slowly, you feel like you're dragging, or you're kind of restless and fidgety. And you may have thoughts of hurting yourself, or thinking that you might just be better off if you weren't alive anymore. So these are all things to keep an eye on. So what do we know about the impact of depression and how it's treated? Well, depression affects everything. It's like this big black cloud that hangs over you and weights you down and feels painful and overwhelming. It impacts your quality of life, your relationships, communication, your ability to take care of yourself. And it may impact your job performance and even your ability to hold a job. The National MS Society now encourages people to have early and ongoing screening for depression from the time of diagnosis. if you haven't been screened for depression by your neurologist or your primary care physician, you should ask to be screened on a regular basis. Treatment by a mental health professional is essential, right? First, to make an accurate diagnosis, and then to give you the treatment you need. And the treatment for depression is kind of a three-legged stool. Talk therapy can be very, very, very helpful. It can be as helpful as medication. There are many, many antidepressants that are very effective for treating MS. And so, excuse me, the optimal combination is both. The medication to get your mood under control, and then the talk therapy to work through the issues impacting your life and how to get on track. And we now know that exercise can improve mood. So exercise that's geared to your abilities is a critical part of that treatment program. So there are several approaches here for Pam and Sam. We really want Pam to be screened and treated for depression if that's what's going on. And we also want her and Sam to have ongoing support for the healthy grieving that they may be doing about the changes and losses in their lives. We want them to consult with a financial planner because there's tremendous pressure on Pam right now to keep working because she provides the health insurance for the family, but that may not be possible depending on what happens with her symptoms. So they really need to talk with a financial planner, and they can call the National MS Society and ask for a free consultation with a financial planner to get them started. They also need to find parts of their lives and parts of each other that have not been impacted by MS. I call this their MS-free zone. It's that part of themselves they need to look for when it feels as though MS is robbing them of everything, because the MS-free zone is what will sustain them and give them the emotional energy they need to keep going. It may be things they like to do together. It may be a love of music, their sense of humor, their spiritual core. It doesn't matter what it is. It's only important that each person finds it so they have that emotional sustenance. And we hope that they can either adapt some of their old activities or find new ones that they can enjoy doing together. So Mandy, how can Pam and Sam start to get some help with these issues?
Right. So I think it's fair to acknowledge that having conversations about mood issues can be really uncomfortable at times, right? And hard to explain, not only to the people that you love, but also to the healthcare team. So here are just some examples of ways or ideas that you can think about to start having these conversations. So to have a conversation with your support partners or with your loved one, saying something like, I don't feel like myself anymore. It just lets someone know that there's been a shift, something's changing, and you want to talk about it. I don't know whether it's aging, menopause, or MS. Again, it's that cue that there's a lot of things going on that you're trying to juggle and you're trying to sort out. You feel pretty far away. I'd like to I'd like to talk about how we might reconnect. And I really like this one because, and I think Roz probably enjoys it too, it's very inviting and it's welcoming a nice conversation without being too forward. So ways to start those conversations with each other. Now, how about the healthcare team? You might have a really brilliant healthcare team, but getting them to have these conversations in the very small amount of time that you likely have with them can be tricky. So how do you get this ball rolling? Perhaps saying something with your healthcare provider like, I'm feeling down and irritable. Can you help me figure out what's going on? We feel nervous about our future. What should we do? Really opens the door to saying, hey, there's a lot I'm anxious about. How can we work with this? How can we change this? We miss doing things together. Can you suggest some adaptations that could help us? So that's a personal favorite of mine, and I hope that if you say that to your healthcare providers, they'll refer you to your rehab team. But ultimately, I think what's important is if you find yourself struggling with mood issues, talk to somebody, tell somebody, even if it's not someone that can directly help you, someone like a Roz. Tell your PT, tell your exercise partner, tell someone so that you can start the ball rolling, start getting the help that you need to help you feel better. So now that we've spoken about mood changes and ways that we can help Pam and Sam with that, and possible conversation starters that you can personally use in your own life, Roz, let's talk a little bit more now about the cognitive issues that people with MS face.
So like the mood issues I was talking about, cognitive changes are also very, very common in MS. And it's been a major change over the last couple of decades. When I first started working in MS, people were told MS didn't affect their cognition. And it's now one of the busiest areas of research and treatment in the whole MS field. And that's because at least 65% of people with MS experience some cognitive changes over the course of their disease. The most commonly affected functions are the speed with which a person is able to process incoming information. They feel like everything is slowed. I've heard it described as though their brains just have molasses in them. So they can't process information, which means they can't follow conversations as easily. They can't plan and prioritize and make decisions as quickly or easily. And it just makes activities during the day more difficult. They report problems with memory, with attention. People who used to be able to multitask say they just can only do one thing at a time, and if they get distracted, it's gone. And they have difficulty with visual spatial skills, meaning getting lost more easily, not being able to find their way around familiar areas, let alone unfamiliar ones. So those are the most commonly affected functions. There are also functions that are not generally affected in MS. General intelligence stays the same. People don't suddenly become dumb or unable to do things. They're the same smart person that they always were, but now there are some functions that don't work as well. Their long-term memory is fine. They don't forget the dress they wore to graduation, or their favorite first date, or a science teacher that they hated. Those are locked in memories and they stay. And people remain able to comprehend what they read. They may not remember it very well, but comprehension is not impacted by MS. Now, the interesting thing about cognitive changes is that they don't really relate very well to other disease characteristics. Cognitive changes can occur at any point in the disease, even as the very first symptom of MS. And in fact, in studies they've done in the last few years of people who haven't even been diagnosed yet, they have what's called a clinically isolated syndrome, meaning they've had one episode of neurologic damage, but they haven't had enough changes to be able to confirm the diagnosis. They already are experiencing some cognitive changes. So one of the reasons we encourage people to get on treatment and stay on treatment is because we're hoping that along with slowing the disease process, we're hoping to slow or prevent some of these cognitive changes that can occur. What these cognitive changes are related to is the total amount of lesion area, the total number of lesions that have been accumulated in the brain. That does impact cognitive function, but also the amount of tissue loss or brain atrophy that occurs. And since we know that that tissue loss and atrophy can occur even very, very early, that's how we know that cognitive changes can occur early and need very prompt attention. Now, these cognitive changes have a real impact on daily life. We know that along with fatigue, cognitive dysfunction is one of the primary reasons that people with MS leave the workforce early. So if we can recognize cognitive changes early and get people the help that they need to manage them, to compensate for them, we have a chance to help them stay in the workforce as long as they want to and are able. So it's critically important that we deal with these cognitive changes early. They also impact relationships and communication because, as I mentioned, if your information processing is slow, and you have difficulty keeping up with conversations and interactions with others, it's very confusing to other people in your life, right? You may not be remembering appointments. You may not remember conversations you had with your spouse in the morning before leaving for work. You may not be able to keep track of things that you need to do at work or to stay organized in your family life. And so this creates tension and misunderstandings in couples and in families. So again, early and ongoing screening are critically important. And the National MS Society really recently published a hallmark paper that has recommended for the first time that every person with MS be screened for cognitive changes at the time of diagnosis and at least yearly thereafter. And the reason we want to do that is so that people can be taught strategies, tricks, tools, whatever they need to compensate for the problems they're having cognitively so that they can continue to be confident and productive and capable in their activities and work and at home. Now, in addition to these cognitive screenings, which are very, very brief and should happen routinely, there are some reasons why some might want a more comprehensive cognitive testing, which can take anywhere from 45 minutes to an hour and a half to 7 or 8 hours, depending on the kind of test battery that you're given. But sometimes it's really important to tease out exactly what's going on. And that longer battery of tests can help you identify all of the areas in which you're having cognitive challenges, but it can also identify your strengths. And those strengths are just as important because you're going to use those strengths to help compensate for whatever difficulties you may be having. And if at any point you are going to think about applying for Social Security disability based on cognitive issues, it's extremely important that you have a full neuropsychological battery and that you and your neurologist actually track progression of your cognitive difficulties over time. That needs to be documented in your chart before you will be considered somebody who's suitable for disability benefits from Social Security Administration. So there are some important approaches for Pam to use, which will not only help her, but will also help Sam and the other people who are interacting with Pam. She's unable to process information quickly, right? So Sam is going to have to be patient. He's going to have to understand that Pam may not be as quick or facile cognitively as she used to be. So Pam needs to allow herself more time to think and respond, and she may need to say to people around her, I'm sorry, can you slow that down a little bit? Or could you repeat that, please? She has reduced attention span. She's distractible. It's hard for her to focus. So when things are important going on at work or in a conversation at home with Sam, she needs to say, I have to reduce the distractions. I need to just be focusing on one thing at a time. Let's turn off the television. Let's go to a quiet room away from where the kids are. Let's make it a focused conversation. And then I'm going to make sure that I understand exactly what you said to me. So, Sam, when you say something to me, I'm going to repeat what I've heard, and I'm going to make sure that I've heard you correctly, and that will help me to remember it. Similarly, for memory problems, she may ask people to repeat, She's going to use reminders and my personal favorite, a family calendar. So a calendar that's posted in a prominent place in the kitchen or wherever, where everybody in the family has the responsibility for marking down what their commitments are, where they're going to be, so that Pam doesn't have to keep asking people the same question. What time are you coming home? What are you doing? When are you going out of town? It's all there in the calendar. And if she has trouble finding words when she's talking, she gets stuck and she can't come up with it, she has to be patient with herself and try to use some word substitutions, workarounds, and be patient because the word will come, but it may not come exactly when she needs it. And so those are some strategies that will help Pam and Sam to deal with these changes. In addition, Pam's going to need some help figuring out how MS and how menopause, because she is in that perimenopausal, menopausal age, can affect cognition. And as any woman of a certain age will tell you, it's very hard to sort out what's going on. It may be impossible to know whether it's MS, whether it's menopause, or whether it's some combination of both. But the point is to understand that those are factors and to understand as much as possible how they may be impacting cognition. Sam's got to help Pam by making sure that he works to create time and space for those important conversations. They have to carve out, and even if it means we have a set time every night where we get together and talk about the day and plan for tomorrow. And when they talk to each other, they have to work at making sure they're connecting, making eye contact, being very, very specific, and repeating if necessary, and then making sure that they've reached the same conclusion at the end of the conversation and that they know what each was trying to do. Sam will need to provide reminders if Pam asks him to, and he needs to cooperate and use that family calendar as well. This is not just up to Pam. So Mandy, what would you suggest for them in terms of some possible conversation starters?
Right. So again, it's really challenging often to start this conversation, right? If Sam wants to bring it up with Pam or Pam wants to bring it up with Sam, I think that we certainly don't want Pam to feel threatened, but we also want to improve the conversation in general. So some ideas to get this conversation started for Pam and Sam, and certainly for all of you out there, if this is a challenge for you, bring up with your loved one, how can we have more successful conversations with each other? Maybe it's taking some of the suggestions that Roz mentioned already, designating a time of day to have those really serious, important conversations versus just having them on the fly. When the kids are talking, the phone is ringing and the TV's on, right? So maybe that's 5 o'clock in the morning, maybe that's 8 o'clock at night when things are calming down. Whenever works for the couple is generally what we encourage. Another suggestion might be, I know you're feeling impatient with me. Can we talk about what's going on? So this is alluding to those challenges with keeping up with the conversation, following the conversation, and kind of being able to organize your thoughts in response to that. So maybe it's taking notes, maybe it's not actually talking about too many issues at one time within one conversation, but just focusing on one issue at a time. So again, bringing that up. Another one would be, you seem distracted and forgetful. Is there something we can do about that? So again, proactive, being proactive. What can we do to make this conversation easier? And for the healthcare team, I'm not sure what's my MS and what isn't. So that's probably something you might say to your neurologist, right? Help me sort out what these challenges are and who else can help me. Which leads me to the next one. Who can help me understand what's happening with my thinking and memory? So to kind of go back to those circles that we spoke about at the beginning of the webinar, hopefully when you tell this to a healthcare provider, they will say, hey, I think you need to see a mental health professional, or hey, maybe we need to send you to a speech language pathologist to use some of those strategies to help make cognition more manageable for you, your cognitive challenges more manageable for you. Lastly, I'm really worried about my performance at work these days. So again, this is opening up the door to whatever healthcare provider you're telling that you're having challenges related to your work because of your cognitive issues. What can be done? Who can help? Speech language pathologists, occupational therapists, mental health professionals, and of course the inner circle of your healthcare team, any physicians and neurologists that you have on board. So we've touched on mood. We've talked a lot about cognition. Now let's talk about something that's a little harder and a little more abstract to talk about, and that's spirituality. So spirituality, how we define this dimension of wellness, is it's what gives you meaning and a feeling of vitality. It's that feeling of feeling centered and connected, perhaps a feeling of calm but yet energized at the same time, but most importantly, empowered. I think it's that feeling of peace and contentment that you may have with your life, that you may have with the world around you. But spirituality is unique to each individual and couple, and more specifically, the spiritual values that you have are unique to you and to you as a couple. So connecting and recognizing what those values are or what those priorities are in your spiritual life is something that's really important. I think especially in the busyness of our lives nowadays, if we don't know what our spiritual priorities are or what really drives us or fuels our soul, it's easy to get caught up in the busyness. I was reading a book and the author used this lovely analogy when she was talking about busyness. So if we think of our lives as a jar and all of the things we have to do in our lives as rocks, and some rocks are small, like volunteering or making sure the house is tidy before the family comes home, or that you have a beautiful Thanksgiving dinner with a beautiful table set up, all the little things in life. And the big things in life are the things that you really value, that are really, really important to you. If you fill your life jar with all of those little tiny rocks first, you're not going to have any room for the big ones, for the things that really matter. So recognizing what are your spiritual priorities, what are your values, what is important to you, and putting it in your jar first can often be a really helpful way to help you manage some of that busyness in the world. I think it's also nice too to have those triggers or those reminders of what your spiritual priorities or values are. So there's a reason why a lot of people have images of their families or their kids on their desks at work, right? So when they're working away, they can glance over and they can see that okay, it's been a rough day, but this is what matters to me. This is what I value. This is what's important. So that spiritual priority, have those triggers available to you. Sources of spirituality are also unique, just like the spiritual values are unique. So some examples that we've listed are nature. I'm from Nebraska. I'm a farm girl. There's nothing better than being outdoors on a cool fall day, riding in a tractor, or just being alone and enjoying the outdoors. Maybe it's connections with others. Maybe it's getting together with your gal pals on a Saturday morning with a bunch of coffee and just gabbing away. Maybe that gives you that sense of peace. Maybe that gives you that sense of interconnectedness. Perhaps it's religion. Maybe it's the rhythm of a particular prayer that really resonates with you, that provides you comfort in times that are difficult. Or maybe it's sitting quietly in a place of worship that really gives you a lot of satisfaction. Hopefully, Again, you're talking to a physical therapist. Hopefully, physical movement is something that gives you a sense of spirituality. Maybe it's a great yoga instructor that just makes you feel so calm and energized and content after a class. Hopefully, it's a good PT, right? Maybe it's creativity, music or art, whatever, again, whatever that source is, just make sure that it's fueling those values and those priorities and giving you that feeling of vitality that you're after. What we do know are often realize that during periods of crises or major life changes, you find yourself on a spiritual journey. And I would say that you often don't realize you're on that journey till you're in the thick of it, right? But sometimes during those periods of crises, it can also be an opportunity. And I realize that's hard when you're in the thick of it, right? But if we can shift that thinking of this crisis as an opportunity for growth, that when you think of that opportunity for growth, you get an opportunity for increased self-awareness. You get you may realize some inner strength that you had that you never realized you had, right? Maybe it's discovering some type of meaning in a challenge that seemed overwhelming to start with. Or maybe it's improving the depth of a relationship. Often I feel like relationships can get stronger during times that are really difficult for people. But regardless of what it is, these crises or these life changes, whether it's a relapse or disease progression or even the diagnosis itself, that can be an avenue to increasing your overall resilience. So dealing with changes and challenges can be exhausting, and it can certainly be stressful to the spirit, right? So what we want you to think about, both individually and together with your key support partner, is to think about what drains you. So what takes away from your spirit, what takes away from your internal energy, and what sustains you. So what gives you that fuel, what replenishes you. So some examples of things that may drain you could be fatigue, whether it's MS fatigue or fatigue just from the craziness of a day. Maybe it's daily stressors that you find particularly draining. Maybe it's just getting everything done. Maybe it's making sure that all those little rocks get put in the jar, right? Maybe it's MS symptoms. Maybe it's mood and cognitive challenges that really are draining. Maybe it's fatigue. Maybe it's difficulties with walking or balance. Perhaps it's life worries. Maybe you're concerned about the unpredictability of the disease. You may be concerned about financial issues or your children. Or it's relationship challenges. Maybe you have a tough boss that's giving you a difficult time, and that's just really draining on your spirit. Sometimes these things that drain you are unavoidable, right? But I think what we can control and what we can work with are the things that sustain you. So identifying, again, what fuels your spirit, what refuels and replenishes you. Maybe it's connections with others, perhaps those interests and passions that really excite you. Again, maybe it's your faith, maybe it's your religion. A good sense of humor always is helpful, and certainly helping others can also be something that's sustaining. My mother actually, we never like to admit when our moms are right, but my mother always would say that when you're feeling down or you're having a tough time, it's really helpful to help others. And I find that to be true. Helping others makes the person doing the helper feel better, but it also is beneficial to the person who's receiving it. So again, everyone wins in that situation. It benefits all spirits. So what are some conversation starters to consider with each other when you're concerned about that spirituality? I feel as though I've lost my purpose. Our roles have changed and I feel disoriented. And that could be a person with MS or a support partner. Could we talk about ways to recapture our MS-free zone lately? It's all about MS. And you know, there's a brilliant psychologist friend of mine, and you may know her because she's on the screen right now. She always says, find a place for the illness, but keep the illness in its place. So give MS the time and attention that it needs to manage it effectively, but don't let it take over the world. Did I say it right, Roz?
You did.
Good. And then the possible conversation starters for family, friends, healthcare providers, or those other spiritual advisors. Our relationship is important to me, but can you help me find some ways to reconnect now that I can't do all the things we used to do together? So how can you find that spirituality with the relationships that are important to you? I'm angry. My faith seems to be escaping me. What can I do? So again, if a religious leader is helpful in this situation, that may be someone that you turn to help you foster and grow your spirituality. So Roz, tell us, as we close out at the top of the hour, what are the key takeaways from our Mood, Cognition, and Spirituality webinar?
So, as I've been talking and then listening to you, Mandy, I've realized how large these areas of wellness are, how much they impact everyone's quality of life, people with MS and support partners. So these are pretty hefty takeaways, but I hope that you'll take them and then bring them to the next session and the one after that, so that we can try and tie this all together for you in a way that makes you feel confident about taking care of your wellness. It's important to remember that people with MS and support partners can experience pretty significant mood changes, and being able to talk about them and explore them and get help with them is important to your well-being. The MS-related cognitive changes that are so common have an impact on many areas of life, starting with employment, communication, relationships, and just your self-esteem and your sense of who you are. Your cognition isn't working the way it used to. So again, to get it assessed and get the help that you need. Your healthcare team can really help you manage these symptoms. So the conversation starters, we hope, are a way to encourage you to bring up these topics with your healthcare providers. You can also contact an MS navigator at the National MS Society, 1-800-344-4867, and have any of those conversation starters with them, and they can help get you the information you need to understand what's going on and refer you to providers who can help you. So that's a magic number to keep in your pocket for any of these issues. Remember that your spiritual life is your own. It's unique to you, and whatever works to help you feel grounded and connected and sustained is valuable. And find what you need and what you need together as a couple to keep you grounded. And these conversation starters can help you on the road to getting the help you need to managing your mood, cognitive changes, and your spiritual needs. I think now we have time for some questions, and we're pleased to be able to answer as many of your questions as we can.
All right. Thank you, Roz and Mandy, for that great information. Hopefully you all received some background knowledge on mood, cognition, and spirituality. See how it kind of fits into the big picture of comprehensive wellness, and got some practical strategies and some conversation starters. So thank you for submitting questions. We're going to try to get to as many as we can. So we got a lot about mood and cognitive symptoms, and we're all about finding solutions to barriers. And it seems like the two biggest barriers for people with cognition and depression is fatigue and also vision issues, which is a very common symptom. Could you talk a little bit about how those symptoms relate to mood and cognitive symptoms, and maybe any other practical strategies of overcoming fatigue and vision issues?
So let me start with fatigue, because I think it's very hard to tease out what is what when you're feeling down and exhausted. So if you remember, one of the symptoms on the checklist for diagnosing depression is either sleeping a lot or not sleeping enough and feeling fatigued and dragged down. Well, we all know that fatigue is a very, very, very common symptom of MS. In fact, the vast majority of people feel fatigue. So it can be hard to tease out whether the fatigue is coming from mood issues or whether it's coming from the MS itself. So it takes a careful diagnosis to know. It's also important to find out all of the secondary issues that may be contributing to fatigue, like multiple trips to the bathroom in the middle of the night, or sleep disorders, which are very, very common in MS. So you may need help from a mental health provider or your neurologist just to tease out what's causing the fatigue. That being said, feeling so drained and tired makes people feel down and discouraged and can add to depression. And feeling depressed can make you feel more tired. So it can become a vicious circle. So getting it appropriately diagnosed, getting the treatment you need, regardless of the source of the fatigue, I think will help the problem. The vision problems are less clear to me because I'm not exactly sure what the person means. I do know that if you're having a lot of MS-related visual symptoms, they can feel very tiring. You may be seeing double, or your eyes may be bouncing around, or you simply can't do the things that you used to do without a lot of heavy-duty concentration, which is fatiguing. Any of those changes can certainly make one feel discouraged or contribute to depression if one is already depressed. I don't think that vision problems in and of themselves cause depression. They just may cause you to feel more discouraged than you were already feeling.
I would also add that if you are having visual changes or visual challenges, if we go back to that circle of people who can help, the provider would be a neuro-ophthalmologist, would probably be somebody pretty important to talk to get some of those visual changes addressed.
That's great. Thank you. We'll get back to that healthcare team in a second. But with spirituality, we also got some questions about barriers and how to overcome them. And the two big barriers, it seems, with spirituality is just stress and the hecticness of our society and life. And then also negativity and having negative people kind of in your circle, that can certainly be a barrier to spiritual well-being. So again, any other thoughts on those two specific barriers, stress and negativity, and some solutions to overcome those barriers?
Well, I'll start and then Roz can add. As far as the busyness, I do think that it is important that you really stick to your spiritual values. Prioritize what is important to you in your life and in that day even, and keep it visible. Keep that reminder visible so that as you proceed through your day, you're focusing on what really is meaningful to you. And then as far as find people that are draining, I don't think it's great to keep around people that are draining you in your life. Sometimes it's unavoidable. So I guess minimizing the amount of time with those draining folks would be a good recommendation. But Roz, do you have any thoughts about that?
Well, I totally agree with you about minimizing contact with people who drag you down. But I think, like anything else we talk about, whether it's a healthy diet that we're going to talk about next time, or exercise and how important that is. That sometimes you need to set the priorities and the boundaries for yourself. What's important to you, and make sure you carve out the time and the space to allow yourself to connect with the things that have meaning to you. So remember those big rocks that Mandy was talking about. Get those in your jar and don't let anybody interfere with those. And then around them, you can do all the other things that you have to do on a daily basis. But make your own connectedness and sense of self be at the core of your day.
It's great advice. Thank you. Kind of combining two questions again. We received questions about how alcohol and cannabis, how that may impact some of these symptoms positively or negatively. Any updates on kind of research on what we know about on the impacts of cannabis or alcohol?
So without getting into a broader conversation about cannabis and its use to manage MS symptoms, I think one thing we can clearly say related to tonight's topics is that we know that cannabis can impact cognition. And so while it may be helpful for managing some of your other MS symptoms, such as spasticity, you need to remember that if you are already having cognitive issues or are concerned about cognitive issues, there's ample evidence that smoking marijuana can impact your cognition negatively. And so you might want to talk to your neurologist about what forms you might use to manage symptoms and what are the side effects you need to look for. In terms of alcohol, I think it's just important for people to remember that alcohol is a depressant. So when people who are depressed drink alcohol, it doesn't bring them up. It actually can increase feelings of depression. And so you want to be careful about alcohol intake. And I think if you're having trouble with cognition and you have slowed information processing, you may want to be aware that, more than a drink or so can also impact your ability to function cognitively in the way that you want to. But these are things that you can definitely talk over with your healthcare provider. Doing any of those things in excess is not good for your health. It's not good for your mental health. And so if you feel you're relying on those things to excess, it's important to reach out and get some help for that.
Great points. And a lot of questions about cognition. So kind of staying on that note, Mandy, you mentioned the healthcare team, and we actually had one person that specifically brought up a PT as well as an OT, physical therapist and occupational therapist. What role specifically could they play in helping with managing cognitive symptoms, or at least kind of slowing down the disease progression when it comes to cognition?
Sure. So I think the first thing to be certain that if you have cognitive issues and you're working with a physical therapist or an occupational therapist, don't hesitate to tell them that. Tell them what your strengths are and how you seem to learn better or retain information, because that can change the delivery of an exercise prescription. So tell them would be the first comment. The second piece is the research right now is trending to suggest that exercise has positive effects on cognition. We can't say 100% for certain yet, but it's trending that way. And in addition, exercise, as Roz mentioned, can have some positive effects on mood. So I guess my best recommendation would be to find the way that allows you to exercise most optimally. Use those healthcare team members to do so, because right now there's no harm in participating in exercise and physical activity. That seems to only be a positive for both mood and cognition at this point.
And on that note, Roz, one potential solution that a lot of people have asked about are sort of the brain games and online computer games that kind of advertise that they can improve cognition and or at least stimulate. Any research on if those actually improve some of these cognitive symptoms?
I think we definitely want people to stay intellectually active and engaged, whether it's reading, doing their job, enjoying hobbies, interacting with others. Anything that stimulates your brain is good for our health, whether or not we have MS. The brain games that are specifically advertised to help MS cognitive problems have not really lived up to the hype. We know that the cognitive remediation strategies and treatments that are used by MS experts to treat cognitive dysfunction are very, very, very specific. They're very carefully developed. They are targeted to the individual and the individual's problems. So I think it's fine to do brain games, to watch quiz shows, to do all of that, but don't do it with the expectation that it's going to treat your MS cognitive symptoms. Those really require the intervention of a trained neuropsychologist using very special and tested tools to treat those issues.
And speaking of kind of identifying and treating those issues, you've received a few questions about whether cognitive changes can be seen on MRIs, and if there's an association between lesions in gray matter and lesions on white matter. Any thoughts for these viewers about whether or not these cognitive changes can be seen on an MRI?
Well, keep in mind that the lesions on MRI and the symptoms that a person has don't actually correlate very well. We know that there are areas of the brain that might cause some problems with vision or with memory. We know that there's some areas of the brain and of the spinal cord, that will cause walking problems or bladder and bowel problems. So there are general areas, but there's nothing that someone will point to on an MRI and say, oh, that's a memory lesion, or oh, that's a decision-making lesion. What happens instead is that there's damage in the white and gray matter in the brain, and the more damage there is, the more likely it is that a person has cognitive impairment. So if you remember back to what I said a while ago, that what MS does correlate with is the total amount of lesion area, the total amount of damaged area in the brain will be related to amount of cognitive impairment. But more importantly, when we see a lot of brain tissue lost, in other words, there's been so much lesion damage and scarring that the tissue in the brain has actually atrophied or shrunk, that is correlated with cognitive issues. So the more atrophy that can be seen on an MRI, and the doctor can see it and can show it to you on your MRI, where there is that atrophy, you're more likely to be experiencing cognitive dysfunction.
That's great. Thank you, Roz. So I think we have time for two more questions. So we'll see if we can do this. We talked a lot about adaptation and finding new ways to do things. And so specifically, this writer wants to know if there's skills to help adapt with just things taking longer, whether it's word retrieval or just sort of everyday tasks. Just things seem to take a little longer than they used to. Is there anything kind of specifically that you would recommend, tips or tools to help adapt just kind of that longer time to do some fairly routine tasks that used to not take that long?
You want to start, Mandy?
Sure. So consulting with a physical therapist or an occupational therapist can help determine how those tasks can be simplified. Sometimes it's using different adaptive equipment. Say, for example, if it's getting dressed, there are different tools like a button hook or shoe horns that can help with dressing, making dressing more efficient. There are also certain exercises that can be helpful too when it comes to improving ability to do some of those tasks. And I would argue that if you're simplifying those tasks, you're conserving some energy. And when you're able to conserve some of that energy, then your ability to dual task or do multiple things at one time, which we all try to do on a day-to-day basis, can be better achieved. And that kind of pulls in kind of the cognitive piece of things. If the motor task is simpler, then the cognitive task can be more complex if necessary.
One thing I would add to that, we didn't talk at all tonight about cognitive fatigue, and cognitive fatigue is really distinct from the physical fatigue that is so common in MS. What can also happen to a person with MS is that they're focusing very, very intently on a task. Concentration is at 100%, and they're under pressure at work, for example, to get a project done, and they're going, and all of a sudden they'll hit a wall. They'll hit a cognitive wall as opposed to that physical feeling. And it's like they just can't think. It's just stopped. And that can be very frustrating to people and slow them down in their daily tasks. And so when you recognize that, hitting that cognitive wall where it's just not working anymore, what you need to do is really stop, turn your attention to something else, even if it's just to do some deep breathing, or think about something else, or get up and walk around. And then when you sit down again, your brain will be able to start doing what you need to do. So I think part of what we need to do is task simplification, making sure that your environment is also adapted to make your tasks as simple and easy as possible, and then pacing yourself, whether it's physical activities or cognitive activities, so that you're not pushing yourself to do more than you can do faster than you can do it. You find a rhythm and you rest when you need to, and that will help you accomplish things.
That's great advice for everyone. And so last question, and we could actually do a whole webinar on this topic, but we have a lot of support partners on our webinar, on our call tonight. Do you have any tips for people living with MS to help support those support partners take care of their mood and their cognition and their spirituality?
Well, I'll start. I'm sure Mandy will have something to add, but I think just asking the question is the right start. People get so focused on the person with MS, her symptoms, his depression, his needs, her challenges, that the support partner just sometimes gets forgotten. And support partners themselves often feel selfish if they even think about their own mood issues or their own worries or their own anxiety. So just starting the conversation is invaluable, right? Saying to your support partner, I also worry about you sometimes, and how are you doing? What's your mood like? What can we be doing to help you at the same time that we're working so hard to help me? That opens the conversation. And I always encourage support partners to go to their own healthcare team, their own primary care providers, and even to the neurologist, and say, I need to talk about what's going on with me as well, because if I don't take care of me, if I don't put my own oxygen mask on first, I can't be a good support partner for the person I love. So I love that the question's being asked and that conversation can happen so everybody's needs can be met.